Well, healthcare systems around the world are actually known for being very conservative. There's actually strong evidence that even current therapies take up to 15 years to be adopted in healthcare. So it's a very risk-averse industry, and rightfully so, because when you look at literally what they're dealing with, it's life and death. So taking up new technologies has always been a challenge, especially those that are disruptive. The healthcare workers do a great job spending their time delivering healthcare, and they spend a lot of their time working out solutions for patients on a one-to-one basis. So supportive technology, which facilitates what they currently do, they take up quite quickly because it fits into their workflow. Disruptive technology, on the other hand, sort of stuff that Clayton Christensen talks about, changes the way they do things. And to do that, they have to change their workflow. And workflow is critical in healthcare. So what we've discovered to date is that to do something disruptive requires change to come from the outside. Healthcare workers are spending all their time delivering their services. They really are, head down, making sure that their patients are getting better. So they really don't have time to find new solutions. So people from the outside have to come in and introduce new solutions, and slowly the healthcare sector will adopt those if they see they are of benefit. It's a great question because healthcare really is a very individual thing. It's very personal. Everyone has a strong stake in their own healthcare. But unless you provide people with the tools and the knowledge to take an active part in their healthcare, you can't just expect them to jump in and deliver their own healthcare. Healthcare providers go through a lot of training to understand the physiology, the anatomy, how disease processes work. And without that information, that knowledge, it's very hard to deliver healthcare. So unless we provide people with tools to do that, it makes it very difficult. Now, the internet is a great tool for getting information. You can get on the internet nowadays and you can find all the medical references you want. The problem is it actually provides too much information and doesn't provide that information in context. It provides volumes and volumes of data for people, but unless they actually know how to use it, they stumble and fall. Now, the healthcare workers do a great job in taking that information and using it, and one of the key things we need to do is make sure that the healthcare providers and the individuals can work together. It's not around healthcare providers giving up their abilities to the individuals. The individual needs to work with their healthcare provider. Technology does a great way of actually facilitating that. You can actually use technologies both in the home and in the hospitals that allow individuals and healthcare providers to work together, and it's that collaborative model which is important. So it's not just individuals taking control of their own health, it's individuals working with their healthcare providers to ensure better outcomes and using the right technologies to make that happen. It sure is a learning curve because it really is a change for both sides. I mean, individuals up to date have been sort of always taught that whatever the healthcare provider does is right. Healthcare providers, on the other hand, have been taught to deliver services and not actually collaborate. Now we need to actually have much more a collaborative model. Great question as well. So Intel's been very involved in innovation for many years. I mean, back in 1965, Dr. Gordon Moore, one of our original founders, published an article which led to Moore's Law, which describes how technology advances rapidly. And we've seen the effect of that. You've seen now that 40 years ago in his article, he talked about people having computers in their homes, which was a revolutionary concept back then. And today we all have some sort of computer technology in our homes, often more than one. That same sort of innovation is what we need in healthcare. And that's why we're really keen to be involved in this space. So Intel's been doing research in healthcare specifically for over 10 years now, specifically looking at what the role of this technology is in healthcare. So we've actually had a team of engineers, obviously developing solutions around that space, but we also have a team of what we call ethnographers. So these are social scientists who actually live in people's homes, spend time in hospitals, spend time in clinics, and watch what happens, understand the current process, and look for solutions where their technology can help. And then we introduce the technology, and again, watch what happens. You need to understand the actual workflow of healthcare and how the technology fits in. The biggest danger we have in technology in healthcare is dropping technology in and not understanding how people use it. So we've actually spent a lot of our time looking at how people use technology in healthcare to make that more effective. We see telehealth as a great solution. We need to shift healthcare away from the hospital and into the home because there's a number of reasons. People would much rather be at home than in hospital. There's strong evidence that when you're in hospital, adverse events can happen. Things can go wrong in hospital. So if you can keep healthcare delivery in the home, especially for the population who requires it most, the elderly, the people with chronic diseases, you can actually not only make healthcare more efficient, but actually improve the quality of the life of the people who are suffering the diseases. You speak to any 70-year-old, They don't want to spend time in hospital, they don't want to spend time in a clinic, they want to be at home with their family and friends. If we can shift the technology to allow that service delivery to be made at home, it'll make a big difference. I think there's a couple of key messages I really hope delegates can take away. We really are at a critical juncture in healthcare now. The system really is under stress, and we see that every day when you open the paper you hear news stories of problems occurring in our healthcare system. So we really need to do something different to solve the problem. We can't just throw more doctors, we just can't throw more nurses at the solution, because we don't have more doctors and more nurses. The system really is at capacity. So we need to start thinking of new solutions, disruptive solutions that will change the way healthcare is delivered. Now, as part of that, we need to understand the role of this technology. The technology itself doesn't solve the problem. The technology enables new models of care, new ways to deliver healthcare, and that's what we need to think about. Ultimately, it all comes down to a partnership between provider and patient. Technology facilitates that partnership, and we need to understand how we can do that more effectively. And critically, we need to understand what it is that's stopping that from happening today. And one of the biggest issues we have is the way healthcare is paid for. Currently, healthcare is paid for by process, not by outcome. We don't pay to make someone better, we pay for particular healthcare processes. And as a result, we can't use some of the innovative technologies in place because currently the payment model requires the doctor and the patient to be in the same room. If we can look at new payment models, change the way the healthcare is paid for based on outcomes, so based on what services healthcare providers can provide to an individual to make them better, we can actually change the paradigm of healthcare. I often like to say that we want to deliver 21st century healthcare, but we're currently doing it with 19th century tools. We really need to change the tools we're using, and also using 19th century payment models. Payment model of when you walk into a doctor's office, we pay you for that visit. We need to change the way we pay for healthcare and the way we deliver healthcare.